If you have swelling in your legs or feet, these exercises can help to reduce the swelling in those areas. However, if the swelling is due to surgery in the hip or the rest of the legs and feet, please check with your doctor to make sure you're clear to do these exercises before continuing. The first exercise is laying on your back with your leg or legs up, depending on where the swelling is. If it's both, you can put both legs up. If it's just one, you can put the other leg down. If the swelling is more in the feet, you're going to be doing movements with the toes. You can spread the toes, you can flex them, you can extend them, you can do circles at the ankles one way and going the other way. If the swelling is more through the ankle, bringing your toes towards you and away from you, doing these a few times, and also slightly bending the knee and extending the knee. And for the hip, you can do slight circles one way and then the other way. You can also just bring the leg towards you and slowly back down and side to side. So do any amount of repetitions that you feel comfortable with, as long as it's not causing any pain or increased discomfort. You can allow the leg to stay up in this position and just rest as long as you feel comfortable. There's really no time limit to this, as long as it works for you. If you, however, notice a lot of tension through the hamstrings or the calf, I would recommend allowing yourself to have more of a bend through the knees to help to decrease that tension. The next exercise will be on the stomach, and this might cause some discomfort in the low back depending on how tight your hip flexors are. If you find that if you put your leg up and the back starts to bother you, that means you most likely have a lot of tension through the quads. So you might want to bring it down lower and just have the knee bent instead of extension through the hip like this. Once you're in this position, again, it's the same type of movements. You can wiggle the toes, bend the toes, extend the toes, point the toes up towards the ceiling and down, getting the calf to work. Do circles with the ankle and circles the other way. You can extend the knee a little bit, bend it, get that movement going to help pump and move that lymph. And with the hip, you can bring the hip up. This is called hip extension and a little bit of flexion. And do a few repetitions like that, and also go out and in and out and in. Afterwards, you can just lay in this position and allow gravity to continue to work on the lymph, and you can have it propped up higher if that is comfortable for you. If not, you can just leave it in this position. So those are the two exercises I recommend that you can do to help with swollen legs. Again, check with your doctor if you've recently had any surgery or if you have any other issues going on to be sure that you're cleared to safely do these exercises. Be well and see you next time.